Hello everyone, welcome to MBBS at Last channel. So today we are going to be talking about an important topic in the lower limb, that is the femoral triangle. So under this we are going to be discussing about its boundaries, its contents, and a little bit of the clinical anatomy. So for the boundaries, what exactly is a femoral triangle? First of all, what is a femoral triangle? Femoral triangle is an inverted triangle present in the anteromedial part of upper one third of the thigh. So it's tilted and it's inverted triangle, and it's present in upper one third of the thigh in the anteromedial aspect. So coming to the boundaries, how is it surrounded, how it is bounded? So for the lateral part and the medial part, for easy remembrance, you can remember that both are of medial parts. So lateral is formed by the medial border, and medial is also formed by the medial border of what? Medial border of sartorius, and this is formed by medial border of adductor longus. Now the base, it is formed by inguinal ligament, which is easy to remember, the inguinal ligament, and the apex is formed by the meeting point of both. You can either say lateral and medial boundaries, or you can say medial border of sartorius and medial border of adductor longus. So for now, let's go with lateral and medial boundaries, or it's better to say medial border of sartorius and medial border of adductor longus. Now coming to the roof, it is formed by fascia lata and also cribriform fascia. The roof is covered by superficial fascia and skin. So you can see that in this diagram. You can see that this is the roof, this is the fascia lata, this is the cribriform fascia, and this is the superficial fascia, and this is the skin. So this forms the roof. Now coming to the floor is it is gutter shaped and muscular because it is formed by four muscles, which are iliacus and tendon of psoas major and pectineus, adductor longus. So the four muscles which form the floor of the femoral triangle are iliacus, tendon of psoas major, pectineus, and adductor longus. So these four form the floor. Now coming to the contents of the femoral triangle, we have the femoral artery and its branches, femoral vein and its branches, femoral nerve and its branches. We have deep inguinal lymph nodes and lateral cutaneous nerve of the thigh, the femoral branch of genitofemoral nerve, fibrofatty tissue, femoral sheath. The femoral sheath is basically, it does not contain the femoral nerve but contains only the femoral artery, the femoral vein, and the lymph node. This one, or you can see it in this diagram very clearly. This is the femoral sheath, this is the femoral nerve. The femoral artery is present here. This is the lateral side and this is the medial side. The femoral vein and the lymph node of Cloquet. So these three are the contents of the femoral sheath. Then we have, of course, the femoral sheath, and yes. Now a little bit about more detail about how the femoral artery traverses in this femoral triangle is that it starts at the midpoint of the base or midpoint of the inguinal ligament and goes downwards and a little bit medial to the apex. So as it is moving downwards and little medial, it kind of changes its position from lateral to anterior, from base to apex, when compared with the femoral vein. So for easy comprehension or easy understanding, you can see here that the femoral artery at the base, it is lateral to the femoral vein, whereas at the apex the femoral artery comes anterior to the femoral vein. The femoral nerve as usual stays lateral to the femoral artery both at apex and the base and apex. Now we are going to be talking a little bit about the branches of femoral artery, femoral vein and femoral nerve. The femoral artery gives rise to 3 superficial branches, 2 deep branches. The 3 superficial branches are superficial epigastric, superficial circumflex iliac, superficial external pudendal. The 2 deep branches are profunda femoris, deep external pudendal. Now coming to the femoral vein receives from 3 branches. Basically, the first one is the great saphenous vein, the second one is profunda femoris vein, and third one, it is lateral and medial circumflex femoral vein. More likely you can even call this as the 4th branch, but for easier remembrance you can put it under one, saying that it is lateral and medial circumflex femoral vein. Now for the femoral nerve, about 2.5 centimeters from the inguinal ligament or from the base, it starts dividing into anterior and posterior divisions. Whereas these two anterior and posterior divisions, they enclose the lateral circumflex femoral artery like this. So they kind of divide in such a way that it encloses the lateral circumflex femoral artery. The anterior division gives rise to 2 branches, that is intermediate cutaneous nerve of thigh, medial cutaneous nerve of thigh. The posterior division gives rise to 1 cutaneous nerve, that is saphenous nerve. So all these 3 are cutaneous nerves. And coming to the clinical aspects, we have femoral hernia, psoas abscess, and lymphadenopathy. Hope you enjoyed the video. Thank you everyone.